Hello students, I wanted to go ahead and say hello and introduce you to your sectional anatomy class. As you see here, I have your learning modules loaded all the way through the entire course, and if you look closely you can see the item is not available until certain dates, so you will be walked through each step of the course and will not be able to jump ahead. It's imperative that you keep up with the course. The ASRT has videos, so if you, for example, we click on the cranium and the facial bones, you will see here maybe that there's a video right here, so download video, and it's a cranium, and you need to click on this portion down here. If you click up here, nothing's going to happen. For all the videos, you'll need to click down on the lower portion. There's transcripts also, but there's closed captioning, so I probably will not make these available for you. If you need the transcripts, you can let me know and explain why. Within the cranial bones, I will also have my PowerPoint, and it'll go through all of the different slices of the anatomy with me talking to you, explaining all the different areas that the slice is covering and the anatomy within each slice. So if we go back to the learning modules, I want to make sure that you understand that week 1, here we are going to be doing Introduction to Sectional Anatomy, and within the introduction it's going to show you what sectional anatomy is, so the different planes. So there's 4 different planes that will be covered, and you'll need to understand the difference between CT and MRI, and I will cover within the first PowerPoint the differences between CT and MRI imaging. We jump right into week 2, which is the cranium and the facial bones. This is one of the harder sections, so we figured we'd do it first. You did have the cranium and the facial bones last semester, so it does feed right into this semester. It is a little more intense in the sense that we really cover the sphenoid bone, all the foramen within the base of the skull. So we'll also be studying the blood vessels coming up and in and all the different areas of the brain. So that section is pretty intense along with the brain. There's a lot of different shades of gray on a CT scan that represent different anatomy. On the MRI, it jumps out a little bit better for you so that you can label the anatomy. Then we're going to go ahead in week 4, you're going to have your first test. So within that first test, it's going to cover the introduction, the cranium, and the facial bones along with the brain. So I try to break it up into bite-sized pieces for you. After the exam, we go to week 5, which is the entire spine. So we cover the cervical, thoracic, and the lumbar spine. Week 6, the neck, which is considered the soft tissues of the neck. Then week 7, we cover the chest. A lot goes on in the chest, so that's a pretty big section right there. We followed, after that is week 8 is the test, so we'll cover the spine, the soft tissue neck, and the thorax in one exam. In week 9, we go into the abdomen. And the abdomen, for some reason, really hangs up all of you. For me, I think it's because I've been doing it for so long that a kidney looks like a kidney. So I think you guys just look at everything backwards, so it makes it a little more confusing for the spleen versus the liver. And so I'll go through the abdomen in pretty good detail for you, followed by the pelvis. The pelvis is actually a very small area. It's mainly the reproductive organs, the bladder, and the rectum, so it doesn't have a lot in it. So the abdomen will overlap into the pelvis in the lab, so when we get to lab. Then we're going to have another test of the abdomen and the pelvis. And then week 12, we go into the upper extremities. Then we go into the lower extremities. The extremities for me are very difficult. They are intensive. There's a lot of muscles, ligaments, tendons, arteries, veins. There's a lot to it. So these sections are at the end, and I cheer you on. because I find it very tedious myself. We'll have an exam or a test going into week 13, and we review for the final, and we have the final. The final is cumulative. You will need to do your workbooks and keep pace with the class. Very, very important that you keep pace with the class. If you fall behind, your lab grade is going to be affected. You will not be able to catch up easily. Very, very critical that you do each ASRT module and my PowerPoint before you come to lab each week to make sure that you are able to do the lab. Be able to tell instantly if you have done the work and the prep required for you to be successful in lab. So your lab grade will be affected tremendously. And it's hard to catch up if you fall behind, in the sense that the tests are every few weeks. So if you fall behind, your grades are gonna spiral. So do your best to keep up. It is fast-paced. The class is a lot of fun. It's very interesting. Lab is great. You learn a lot. So when you do your CT and MRI rotations, you are very savvy with the anatomy that you're looking at. I'm really excited to teach this class. This is my 5th year, and I hope that you get as much out of it as I do teaching it to you. All right, I'll see you in lab.